Welcome to the Deep Dive. Today we're exploring something truly transformative, AI's role in the future of cancer care. We're basing this on a really comprehensive study that looked at global research trends, all the way from 1994 to 2024. Our mission, pull out the key insights for you.
And it's such a critical topic. I mean, the numbers are quite stark. Around 20 million new cancer cases globally in 2022 alone. And that's projected to hit maybe 35 million by 2050. So AI isn't just, interesting tech here. It's potentially a game changer.
Okay, so let's unpack that research growth first. The study points to a huge acceleration, especially since 2020. We're talking over 500 publications by 2024. Is that just more noise or real progress?
Well, it definitely shows massive focus and investment. And what's fascinating is where this is happening. The U.S. leads, clearly, about 36% of the papers, 188 articles. China's next with around 15%.
Right, and the top institutions.
Get this, the top 10 are all in the U.S. Harvard's #1. But, while the U.S. is dominant now, that 36% means, well, over 60% of the innovation is elsewhere. And China's catching up fast. We might see a shift there.
Interesting. So let's dig into what these papers are actually about. What are the hot topics?
Yeah, the keywords tell a story. Artificial intelligence itself, 131 times. Machine learning, 103. And then breast cancer pops up 70 times.
So breast cancer is the main focus area.
It's the most studied tumor, yeah. 71 dedicated papers, followed by colorectal, lung, and prostate cancers. Those are the big ones. But what's also interesting is seeing newer keywords gain traction. Things like model and human papillomavirus or HPV.
HPV. So AI is being applied there too.
Exactly. Seems like there's growing interest in using AI to tackle HPV-related cancers like cervical or head and neck. It's a big public health issue.
Okay, so we know what they're studying and where, but how is AI actually being used or, planned to be used in cancer care?
Oh, it's really across the board. It's not just about finding cancer earlier, although that's huge, especially with imaging. Think about patient education, AI chatbots, even game-based tools, making complex info more accessible. That's a subtle but important shift.
Interesting. Like helping patients understand their own situation better.
Precisely. And then there's symptom management, remote monitoring systems. There's one called Symptom Care at Home mentioned, plus streamlining things for nurses like predicting emergencies. And of course, the big areas, drug development and precision medicine.
Precision medicine meaning?
Like screening tons of potential drugs faster or even designing personalized treatment combos based on an individual specific cancer.
Wow. Okay, that sounds incredibly promising. But it can't all be smooth sailing, right? What are the big challenges, the hurdles?
Definitely not smooth sailing. There are significant hurdles. One major one is the black box problem.
Meaning we don't always know how the AI reached its conclusion.
Exactly. And that makes it hard for doctors to fully trust it or explain it to a patient. That's a real barrier to adoption.
Okay, I can see that. What else?
Generalizability is another. Making sure an AI trained on one group of patients actually works well for everyone, avoiding algorithmic bias.
Right, ensuring it doesn't worsen health disparities.
Yes. And then there's the practical side, just fitting these complex AI tools into busy hospital workflows without making things more complicated. Plus, ethical concerns loom large. Data privacy, who's responsible if the AI gets it wrong. Many oncologists worry about liability even if they see the potential.
So, quite a few things to figure out still.
Absolutely.
Okay, so wrapping this up. We've seen this incredible explosion in AI research for oncology, leading countries, key cancer types, and really diverse applications from education to drug discovery.
Right. The potential is undeniable. But realizing that potential means seriously tackling these challenges. The black box, the bias, the practical integration, the ethics. That's the crucial next step for AI to truly revolutionize cancer care equitably.
So what does this all mean for you listening? It really highlights AI's growing footprint in healthcare, and it pushes us to think about that balance, the balance between powerful technology and the human side of care. Maybe consider this. How might this wave of AI reshape your own future experiences with healthcare, particularly in something as personal as cancer care?